few other things discussing about addiction therapeutics. As we have here many psychiatric residents, those who are going to be the next generation of addiction psychiatrists, we wanted to make sure that you know that things are moving forward really fast and very exciting in the field of addiction psychiatry. And I would like to encourage others to join us in this field. And I was just talking with one of the colleagues from UAE that they start a new addiction psychiatry fellowship in Dubai. So things are moving forward. So if we hope that we can engage and involve others in this field and bring them to the field. So we had one day on Innovation Day for Addiction Therapeutics in May 2025 in Hamburg. Group of speakers, they are all kind of online available. So this is on that YouTube channel. And we recorded all the discussions, one-day discussions about what are the most advanced things that are happening in the field of addiction therapeutics and what are the innovations. Even discussing about the innovations that are happening with different receptors for opioid use disorder, from NMDA, dopaminergic, opioidergic medications, and new other receptors. And one of those receptors that you can see here on the bottom of the page, orexin, is the one that we have been discussing about DORA medication. Severex and things like that are helpful for sleep, but also that line of medication, because orexin is important for your drive, and it's also contribute to level of kind of drug-seeking behavior that they have, and when you block that, there might be potential to reduce craving and drug-seeking behavior. So there are lots of interesting things that are happening in the field, and there are many companies that are involved. So when you start working with those companies, you see that there are many new companies that are specifically working in this field. And we had lots of interesting discussions. We started with some like a global needs for innovation, then innovation molecular targets. We had industry talks, and then we had innovations of behavior and circuit level therapeutics and industrial academia partnership. In one of the talks, in the last panel, panel 4, we had Shekhar Shetty. And Shekhar Shetty was presenting a new compound that is naloxone for stimulants. Do you see what I mean? Naloxone for stimulant. So something that would block stimulants when people are intoxicated with the stimulants. And there was a discussion about that molecule and the company that they have, and that received FDA kind of initial clearance just September 30th, just 5 days ago. So we have been discussing that in May in one of the ISAM meetings, and it received FDA clearance just a few days ago. It's some kind of, the field is just moving forward. So sometimes people think addiction psychiatry is not that much an exciting field. There is not much of innovation. There are many exciting new things that are happening in the field, and we really like to encourage you to join us there. But meanwhile, one of the really important things in this field is when we have been discussing about innovation and addiction therapeutics, we also invited people from those with lived experience and living experience with substance use. So we invited people from what we call Input, in a national network of people who use drugs, Input, and receiving their feedbacks. And when we have been discussing about some of those innovations, kind of neuromodulation, new circuit-based interventions, new brain stimulation interventions, and talking about robots, how to find those circuits and target them. When Anton came to the podium, he mentioned that what Hamed was presenting was very scary to me. So we have been just thinking, okay, we can just develop something very kind of innovative, but those who are going to actually use it, they think that, what are you doing? We are not gonna put those electrodes in our brain to treat our addiction. So it's very important to make sure that those who are in the community, and when we are developing something with them, it's nothing about us without us. We need to engage them in these discussions and having them as a part of the network. So that is what we do in Minnesota. We have a Minnesota Innovation in Recovery Network. And we have neuroscientists, psychiatrists on one side of the table. The other side is people in recovery communities, people in treatment programs, and having them as a part of a discussion and global innovation that is happening. And developing specific materials that talk about innovative ideas in addiction therapeutics, brain, how brain works, giving them an understanding about the brain and different aspects of brain functions, and how we can communicate about those specific interventions that are targeting those circuits, and developing materials that are going to be helpful for those communities. And the good thing is some of these materials are now being translated into 22 different languages. So people around the world, they are using them and they are available in different languages. So you can have access to them through that sort of portal. And the next innovation day is going to be in September 30th, 2026 in Rotterdam. So if you are interested, and we have a Golden Brain Award that we give to most innovative ideas. So they compete, they send their proposal, and then we select the best 10 of them. They come there and they just present what they are doing, and then they give the best. Golden Brain goes to that specific team. So that is the kind of, we try to get especially young people and innovators involved in this field. A few last slides. As we have been discussing about TMS and circuit-based interventions, that's another level of things that are happening. We have a specific panel in American Academy of Addiction Psychiatry, specifically discussing about when we have people with depression and they have substance use disorder, how can we proceed with circuit-based interventions like TMS? And while there are many people in the community that they feel that when you have a patient with substance use, they usually do not accept them in some of the kind of more advanced therapeutic options. There is a new guideline for TMS for depression. And specifically they mentioned that if you have substance use disorder, most of the substance use disorder, you should go and be abstinent for 2 months and then come back and then we will treat you. And we know it is not the reality of addiction psychiatry. So we cannot just let those who have diabetes just go and be abstinent, not use sugar for 2 months and then come back and will start your treatment. So this is not how things are working. And this is what other speakers have been mentioning. We cannot just tell them, okay, just go and stop. So we need to consider that as a part of the therapeutic. We submitted, and this is on preprint, that was on preprint of just 2-3 days ago. We showed that in 4,000 patients that are being treated with TMS with substance use, no single seizure that reported there. So it's pretty safe, and you can go to the details about that there. So I'm going to stop here. Please use the mic, and if you have questions from the speakers, we are here to, or you have any reflection, please, go ahead. And please do not be shy, just let's talk together and see how we can develop that community together. And I wrote a few other points about the discussion that we had so we can further discuss about some of the collaborations that we can do together. Please.